Hey folks, welcome back to Dub Actor. This is Chris with a wrap up and commentary on the press conference or Zoom session, I should say, by the South African Minister of Health here on the 3rd of January 2021. That, of course, is Dr. Zweli Mkhize, who is the Minister of Health in South Africa. Now, imagine when Mkhize took this post on the 30th of May 2019, he never envisioned such a calamity like the COVID-19 scamdemic to take place, and what a brilliant opportunity for fascists to take over the world. Suspect he never saw this opportunity coming. He is a genuine medical practitioner, so we'll give the man credit for that. But he and his government and the government of President Cyril Ramaphosa seem completely unprepared to deal with anything related to COVID-19. They told the public back on March 27th when they imposed a month-long lockdown, or 21-day lockdown, whatever it was, something like that. When they imposed that this was necessary to get the hospitals and clinics prepared, to get ICUs, intensive care units ready to deal with the onslaught of the coming cases. Of course, they knew very little about the virus back then when they took these actions, and all they managed to do was kill innocent South Africans by overzealous police and military enforcement in the townships, and then withdraw from there, allowing people to spread the virus like wildfire. In addition to that, they criminalized the lawful behavior of nearly 250,000 South Africans, mostly in the Western Cape, almost entirely white and colored South Africans, whom they harassed during this lockdown while letting most of the population run rampant, spreading the virus. They also told us they needed to, that time, prepare schools to clean them, sanitize them. But that beggars the imagination. You don't have to be a scientist to understand that the virus is RNA. It's comprised of RNA. The RNA, when exposed to ultraviolet radiation, is damaged or destroyed. When it is left out in the open for a period of time, it is no longer viable. So after a month, 6 weeks of schools being closed, what exactly needed to be sanitized in these schools in order for them to be reopened? I don't know what it was, but the schools weren't ready either. So they've proven over and over and over and over and over and over and over ad infinitum that they are completely incompetent in South Africa. What of the $5.6 billion that's been loaned to South Africa by the international community? I'm talking specifically in July and August of 2020 when the African Development Bank gave South Africa's government $285 million US for a loan. The new development bank, also known as the BRICS Bank, gave South Africa $1 billion. And then finally, the International Monetary Fund provided $4.3 billion in emergency loans at 1.1% interest rate. That equals $5.6 billion, folks. Where's that money? Where did it go? Many people in South Africa have never been paid their unemployment insurance for having lost their jobs. That money's been pilfered and disappeared, despite the money having been paid into it by their employers and or employees. And we've seen many people not getting things they're entitled to that they paid for by the government. Where's that money gone? Meantime, today's press conference / Zoom session, in which many of us tuned in so we'd hear what the Minister of Health had to say, turned into less of a public information briefing and much more of an internal bureaucratic meeting. I felt like I was once again sitting on a PEPFAR panel, President's Emergency Program for AIDS Relief, at an American embassy, listening to people from different parts of our government go on and on and on about the mind-numbingly boring things that we must do in order to make a program take place. This was a programmatic briefing, not an information briefing. You can be excused if you're a South African for having listened to the health minister's briefing, and this was the end result of your listening to it. Seriously, this was a programmatic briefing. This was not helpful to the public, but there were a few things that came out of it. Number one, it seems pretty clear that South Africa has no plan. They're talking about a plan, but it seems as if they're formulating the plan as it presented to the people. This is insanity. They've had nearly a year, and they don't have a plan. So the plan I'm talking about specifically is rollout of the vaccine. Why didn't they have a plan and put the structure in place and the superstructure in place for how you would distribute a vaccine, how you would procure it, who would pay for it, how it would be rolled out, who would get it? Why wasn't this decided months ago? It doesn't take a team of rocket scientists to come up with answers for this. It just takes some people good at bureaucratic action. That's it. Yet they seem completely unprepared for this. They're talking about rolling out the vaccine at the end of 2021. Initially, he talked about the people to get it would be the people who are vulnerable. Healthcare workers. Then he said the vulnerable. Then he said the healthcare workers again. So I don't know who's getting it. Healthcare workers or the vulnerable or both. And how are they getting it? There aren't going to be enough doses. Where are they getting it from? We get a presentation by Professor Barry Shube. And then we get a presentation by Dr. Anbar Pillay, both of which are not particularly helpful for the public. And Dr. Shube has to tell us about the CVs of all the people on this body, which nobody gives a flying flip about. Your bona fides are not impressing us. if it was your stream and you were introducing yourself for the first time, I got it. But you are part of someone else's briefing. It was his job to introduce your bona fides or tell you to introduce your bona fides. Tell us what the hell is going to happen here. You're talking about local manufacture of what? There's no vaccine in development in South Africa. There's no vaccine production in South Africa. Are you going to get the ingredients and the agents from a global producer like Moderna, Pfizer, or someone like that, AstraZeneca, and then you're going to replicate that? I think they might have an issue with you stealing their vaccination. There might be some intellectual property problems going on there. Now, this is all part and parcel of the government of South Africa begging for vaccination, for vaccines. You see President Cyril Ramaphosa talking about, ooh, give us the vaccine for free. Equitable. I keep hearing equitable, but I don't see any equity. I see no contributions from South Africans. And I don't want to hear about money they put in the COVAX thing from the World Health Organization. That's all bullshit. There's no vaccine coming from the World Health Organization. They're procuring it from China. Good luck with that. That's the people that gave us the virus. And they're not talking about actual vaccinations from around the world. So interesting to see that the health minister of South Africa talked about 67% of the population for herd immunity. Well, that tells me right away that South Africa is not having any contact with the U.S. government when it comes to this. So anytime they say they're working with the U.S. government, they're just lying. Because Dr. Anthony Fauci has told us himself earlier this year that 60% of the population immune to the virus is herd immunity. Then he's changed that, and he keeps changing it. On Christmas Eve, he gave an interview in which he said, well, because I see polls where people don't want to get vaccinated, I'm just going to keep raising the number. So, I'm not going to say 90% of the population has to have immunity before we achieve herd immunity, but I have raised it from 70 to 75 to 80 to 85% now. What? So if Dr. Fauci is saying it's 90% of the population has to have immunity in order for us to achieve herd immunity, why is the South African government saying 67%? The World Health Organization itself has also been upping its numbers and also been contorting the definition of what herd immunity is. They've completely obliterated the term herd immunity. Now, there are debates about herd immunity, as there are debates about what level of population needs to be infected or sick or immune before you reach a pandemic. That's a debatable point too. But that's been played with all this past year by people in the field and fake medical practitioners debating that term. Well, now we're monkeying around with herd immunity. Now, it can be different for different diseases depending on just how lethal or just how easily a virus is transmitted. So, but still, they're clearly not talking to the Americans. 67%. That was interesting to hear. I said that they're taking their guidance. Mkhize said they're taking their guidance from the World Health Organization. Well, good luck with that. That's the same organization that told us you couldn't transmit it human to human in January 2020. They told us you couldn't give it to your pets. They told us that the death rate, the fatality rate was 3.4% of people who tested for it. No, that's fiction. It's 0.2%, a tiny fraction of the lie that the Chinese Communist Party and the World Health Organization, and for that matter, the Center for Disease Control and Dr. Fauci told us in January of 2020. They're full of manure. And so, yeah, you're going to take your guidance from the World Health Organization. Well, good luck with that. You're gambling with the lives of South Africans and not doing your responsibility. What is this repositioning of the continent? And why is the Minister of Health in South Africa doing work for Africa? See, here's a problem. Yes, Cyril Ramaphosa is the seated chairman of the African Union. But that doesn't give him authority to use his ministers in South Africa to do government for the African Union. There's a bureaucracy in Addis that does that work. You, Mr. Mkhize, are not the health minister for Africa. Stop that horse shit. You have nothing to do with the health for Africa. Your responsibility are the citizens of South Africa, not Ethiopia, not Mali, not Mauritania, not Burundi, not the Comoros, South Africa. That is your responsibility. And anyone who enters the country, that is your responsibility. Oversight. That's it. Repositioning of the continent. Stop it. Stop it. You have no business dealing with Africa. Also, he's talking about we're working bilaterally with pharmaceuticals. That's not bilateral. Bilateral is a government-to-government term. You're not working bilaterally. You're working in coordination. You're negotiating with pharmaceutical companies. Get the terms correct. Stop using your government speak to the public. You are in negotiations with pharmaceutical companies to deliver vaccine. Now, how are you going to pay for that? Where's that $5.6 billion? That's what we want to know. Wow, local manufacturer. And by the way, they showed us on their PowerPoint slides. Thank you so much for sharing that. They showed us the members of this vaccine task team, as it's called. It includes an ethicist. That's right, Dr. Ames Dye, an ethicist. Wow. You need an ethicist on that. So are your ethics so weak that you have to have an ethicist there to tell you when you're doing something inappropriate? Come on, man. Big government nonsense. There's no time for this. No time for this. Frankly, I think that at this point we'd all just be better served by contacting the local Sangoma and asking for some muti. If you don't know what that is, a Sangoma is a witch doctor, a local traditional healer, and muti is witchcraft, traditional medicine. Anyway, so not to conflate the two, they're not the same, witchcraft, traditional medicine. But anyway, the point is that these people are clueless, and they're talking about, so here's the upshot. If you want to look at some analysis, they are now cautioning and telling you, they didn't say caution, but that's what they're doing, that they will not have vaccines rolled out till people to the end of 2021. Given that we don't know how long the vaccinations confer immunity, but we suspect it's just 4 months. I mean, if you've been sick with it, you only get immunity for 4 months, according to the frauds at the Centers for Disease Control, who said that Donald Trump will be dangerous within a matter of months because he can get it again. Of course, they don't know that. They're just guessing. No scientific data that they offer to back that up. But let's presume that 4 months is the amount of time you get it, because it makes sense that it's a short period of time. If you get influenza, you can recapture and get sick with influenza again later. It only gives you a short period of time because the virus is constantly mutating, new strains are coming up, and your body doesn't recognize that you fall sick as you build immunities to it and then vanquish that variant. So let's make the same presumption that you get 4 months from the vaccination. Well, if they start vaccinating people in March and they don't finish vaccinating people in December, then they're going to have people who in March, April, May, June, July, by September can get the disease again, can get sick again before they even inoculate the whole country. So why are we bothering here? Either get everyone done within a period of 3 weeks or don't bother. Don't bother. People will get sick on their own. It's not 100% effective vaccination anyway. So this is just absolutely clueless what's going on in South Africa. So here is what some people are going to propose to you. The reason that they're saying this is that they don't have money. They don't know how they're going to pay for it because they're too busy stealing the money they've already gotten from the handouts from others. Number two, they are going to roll it out so late because they're at the back of the line because they've done very little contribute to the global effort to develop vaccines other than put their hands out and beg. Number three, one reason, now this is sardonic and sarcastically said, is that the ANC will use this as an opportunity to postpone the 2021 municipal elections, which it's very likely that they will be obliterated at the polls by people who are angry with their stupid, feckless policies. Their crushing of liberty, their criminalization of legal conduct, their banning of tobacco on no scientific basis whatsoever. Their banning of e-commerce, which is the dumbest, most moronic thing I've ever heard of. Their banning of sale of cooked chicken, open-toed shoes. Of course, we know the primary vector for COVID-19, of course, is not droplets. It's not surfaces. It's not coughing on someone. It's not sneezing. It is open-toed shoes. That big toe is the primary vector. Of course it's not. Why would you ban open-toed shoes? Utterly ridiculous. This is the party that brought us this moronic response to this virus. What do you expect? So today's Minister of Health briefing from Mkhize, a medical practitioner who took over as Minister of Health on 30th May 2019, shows that South Africa is, after almost a year of this nonsense, no better prepared, has no concept of what the hell they're doing, and they really have wasted a year and destroyed South Africa's economy. To what end? To what end? Well, folks, if you're not a subscriber to Chris White Africa, I ask you to become a subscriber by just pushing that button right down there. Subscribe to the channel. It's absolutely free, no charge for it. If you'd like to get notified of updates, then I suggest you toggle the bell icon and select notifications, all notifications. And then you should get notifications if you have the application installed on your mobile device. 30 minutes before every live stream or video premiere, it should let you know that I'll be going on. And if you're not sure of the schedule, 7 days a week, twice a day, we have the Stray Voltage program, a live feed, a live stream broadcast in which we talk about news of the day and we discuss topics that are apropos from political, cultural, and life standpoints, as well as sports. So feel free to become a subscriber. Feel free to leave a comment for this video if you'd like. And finally, I ask you to smash the like button because likes drive viewership, and we're looking for more viewers to spread the word. There you have it, folks. Today, the 3rd of January, 2021. South Africa's health minister, Mkhize, has had a press conference in which he's pretty much just left people befuddled. All we've really learned is that they have no plan, they have no money, they are formulating a plan now after 9 months of this bull, and that they believe that 67% of the population immune is herd immunity. That's probably more accurate than the U.S., and that they are repositioning of the continent. I really don't know what that's all about. Thanks a lot for tuning in, folks, and I hope that you enjoy the content and feel free to become a subscriber. Thanks a lot, and thank you for your custom.